Thank you so much, Chrissy. According to a new study, gym wear trends may be to blame for a rise in liposuction. So Dr. Chafu from La Jolla Plastic Surgery and Dermatology is here with more. And first of all, thank you for being here.
Good to see you, Kristina.
It seems kind of like a contradiction. Wait,
Exactly.
People are getting liposuction to be able to fit their gym clothes, or what's going on?
Well, I think part of it may be that people are, wearing this leisure wear, so clothing that tends to be more form-fitting, is athletic type of wear, and so people are becoming a little bit more concerned about how their appearance looks versus looser clothing can hide a multitude of sins, so to speak.
Interesting. So I see a lot of leggings. They have like the high-waisted leggings, which I like anyway.
Right.
But so you're saying that people are starting to do liposuction maybe in like these areas so they can fit
problem
into
areas to fit, so they don't notice the bulges. And the thing that liposuction is great for is improving small areas or contouring areas. The problem areas that no matter how much weight you lose, you may keep those small areas.
Interesting. Okay, so but what should men and women know about liposuction before they start to say, oh, well, I have this problem area and I want to fix this?
Right. So I think the take-home message is that it's not the device, but it's the doctor. Make sure if you're going to go and get a cosmetic procedure, the four letters I have for patients are ASPS. So make sure you see a doctor that's certified by the American Board of Plastic Surgeons, a member of the American Society of Plastic Surgeons, because unfortunately, in today's world in 2019, if you take your dog to the vet, you're seeing a veterinarian. If you go to have cosmetic surgery, you may not be seeing a board-certified plastic surgeon. Anybody after medical school can open an office and start doing liposuction. And while it can be a smaller procedure, it's still an operation with its own risks. And so you want someone that's certified, that's qualified. It's not going to it's not going to take your place for eating healthy, for making sure that you exercise properly.
Okay, so make sure you have the right surgeon. And again,
Absolutely.
you said ASPS.
ASPS,
okay.
So the four letters.
Okay, and just so everyone knows, you may not, it may not be possible to slim down exactly what you're looking for. So it's important to speak to.
It is. See your board certified plastic surgeon and understand that it's just it's treating some small contour areas that liposuction works great for, but it's not really a substitute for really losing weight.
Okay.
That's diet and exercise.
That's important. There's one more thing that I want to talk to you about because it is getting warmer. I mean, it's a little cooler today, but we're approaching the summer months. Sandal season, hiking boot season.
Right.
So a big thing that we need to be careful about are blisters, right?
Yeah, very common. And they tend to be in the same areas, Kristina. They're areas where, very painful. And they're obviously, if your shoes fit too tight, or sometimes if they're actually too loose, you will notice that you get them. What happens with a blister is there is a space between the epidermis and the dermis part of the skin, and there's that friction or rubbing that creates a fluid-filled sac called a blister. And so there are things you can do to reduce the chance of that.
Okay.
A simple thing I would tell someone is, using that surgical paper tape that you can get from a drugstore, working that over the area, making sure if you're wearing lace shoes, you're tying them up tightly enough.
And does the shoe really matter? It
does not matter. You can get it in any kind of shoe. What matters is the shoe fitting properly? So a good idea is if you're going to go on and try on a new pair of shoes, wait until later in the day because your foot may be a little more swollen, you may have a little bit more weight or fluid on, and you want to make sure that you get those shoes worn in before you wear them for a long period like hiking or some other activity.
Whew, okay, that was a lot to talk about, but this is all good stuff. Thank you so much for being here, Dr. Chafu. Thank you.